In the hemodialysis, one of an important indication if we take acidosis and hyperkalemia. In that, regarding acidosis, few residents were having doubt where the bicarbonate comes from. It is a sample ABG. Even in this, if we see there is severe acidosis, even though this ABG respiratory is there, but many a time severe metabolic acidosis might be there. The normal pH is coming down, patient is accumulating more of acid. But during dialysis, where the bicarbonate comes from? In the process of dialysis, we will show you where it comes from. This you can. So this is the bicarbonate powder. The acid formulation, sodium, potassium, or is in different liquid form. Whereas if we take this bicarbonate, is it in the powder form, solid form. So it is mentioned as nephrobicarb part B. B stands for bicarbonate. In this, they have mentioned the detail how it have to be mixed. One packet of this, specific packets will be having specific detail. This have to be mixed in 9.5 liter of water. So this have to be mixed. For mixing, there are two types of method. One is manual. Manually in the bucket or clean container, it have to be mixed. Another one is using this machine, which is nothing but bicarbonate solution mixer. So this container is approximately 100 liter. The container are available in various volumes. This is of approximately 100 liter. So as per this specification, we have to put 10 packets of this bicarbonate powder in this. Then 100 liter of water. The water have to be RO. The same water that we use for the dialysis patient, that same RO will be coming through the line that have to be used, not the normal RO, because patient will develop reaction if normal water is used. The dialysis specified, quality checked, endotoxin should be low, the TDS should be low, that water have to be used. Water and powder will be put it in this container. This container is having two pumps. Basically this pump mix it so that there won't be any debris. Suppose if any debris or some waste, unfortunately if it is present in the packet, that will be filtered out from this side. There are two filters present over here. Those two filter onto the container so that the mixing will be regular and the bicarbonate and the water form a uniform solution similar to the IV soda bicarb. That final, once the solution is found, we can take the output through this one. You open it, that will come in the container. These kind of containers will be there. These kind of containers will be there. In that, bicarbonate solution will be taken and that solution will be taken to the dialysis machine. Students also had this doubt, nephrology resident. This contains sodium bicarbonate. Sodium is also there. The final sodium where the dialysate will be delivering to the patient, that contains this sodium also. Another question, apart from soda bicarb, is there any other formulations are available? Acetate, citrate formulations are available, but not most, in almost all the places only soda bicarb is being used because of the so many advantages it provides. Easy to prepare, manual, and this method we have seen. Once we fill that sodium bicarb solution in that container, finally where it goes, we will show you. That powder is mixed, solution is formed, that can will be brought here. One contains electrolytes, one contains bicarb, RO is coming from bag through the supply to the machine. So water, electrolytes, bicarb, all three get mixed and come in contact with the patient blood. So patient is having acid, this is having bicarb. That is where the bicarb comes from. So once the patient have acidosis, bicarb through various process it is coming. Once you see in ICU, you will be using the IV bicarbonate direct. In dialysis, this is how this is being formed and acidosis is being corrected. One can separately for bicarbonate. A student can try to answer why this is separate. The bicarbonate is separate, sodium, potassium are separate. Why? The answer is if it is in the same container, it will precipitate. So that is why it is in the separate container. Whenever this container gets empty, the alarm will come. So this is all about how the bicarbonate comes to the dialysis patient who are having acidosis. That's all. Bye bye.